Alrighty, we're going to look at the heart. A couple things before we get into it is some fundamental concepts really quick that I think are going to help us understand exactly what's going on with the heart. So quick fundamental concepts with the heart to make our lives a lot easier. First one is this, is that you've maybe heard of blood vessels, and we're going to talk about specifically the blood vessels called arteries are going to carry blood away from the heart, okay? Which means that veins are going to carry blood to the heart. So veins carry blood to the heart, arteries carry blood away, and if you just want to remember, artery starts with an A, so does the word away. Other concepts here is that the atria of the heart, we've got a four-chamber heart, the two upper portion of the heart are going to receive blood. And then the ventricles, which is the bottom half of the of the heart, are going to pump blood away. Okay. The only other concepts that I think are important is the word pulmonary, which just means having to do with the lungs. Okay. And then the other one that we might run into is coronary. And that just has to do with anything having to do with the heart. So your coronary veins or coronary blood vessels, coronary arteries are the arteries that actually feed and supply the heart with oxygen, not the body. Okay, so there we go. So let's take a look at our heart. Pretty plain right now, but I just want you to understand not to really memorize the words so much as really understand how blood flows actually through the heart. Okay, and so all the words we should understand actually play a role in helping us understand what its function is. Okay, so we're going to start right here, and this is going to be our, we'll call this the right atria, RA. Okay, and so what we're going to do is we're going to say, okay, this is where atria receive blood. And so this is where blood from the body is going to enter the heart. Okay, and they enter through two really large veins. This one coming from the upper half of the body is called the superior vena cava. And this one down here, you can guess, is the inferior vena cava. Again, inferior coming from the lower half of the body. Okay, and so if we've got our drop of blood, we've got a red blood cell in here, what's going to happen is it's going to get pumped from the right atria to the right ventricle, right down here. Okay, what it has to go through, what controls the flow of blood in the heart is going to be different valves. Okay, and so what it's going through is this one right here, and this one is going to be, it's called an atrioventricular valve, because it's between the atria and the ventricle. And this one specifically is called the tricuspid atrioventricular valve. Okay, and it's hard to imagine now. It's got two flaps here, but there would be a one right back here. But it's kind of hard to imagine with our drawing here, 2D drawing. So anyway, so this is the valve that separates between right atria and right ventricle. And if you can imagine, blood goes through this, and actually blood is then going to go out to the lungs. Okay, and so we can do some arrows here. And so before it goes out through the lungs, however, it has to come through another valve. Okay, this valve is going to the lungs, and our word for lungs is pulmonary. So this is actually the pulmonary, and we're going to call it a semilunar valve, or just pulmonary valve is fine. Okay, and then it goes out through, again, arteries take them away from the heart, so this is going to be your pulmonary arteries. Okay, so when blood goes to the pulmonary arteries, it's going to end up in the lungs. Okay, and so here's our lungs here. We can just imagine. Okay, and what happens in the lungs then would be this blood passes through the alveoli, it goes through the lungs, and what actually happens is it exchanges CO2 for oxygen. Okay, and the whole point of blood going through the lungs is to get oxygenated. Okay, and so when it comes back to the heart, we're going to represent this with a red color as oxygenated blood, but it's going to enter right through an atria, through what we're going to call the pulmonary veins right here. If you remember, veins carry blood back to the heart, and the part of the heart that always receives blood is the atria. Okay, so this is going to be the left atria receiving blood from the lungs, which is now red because it's oxygenated. Okay, and so then this is going to pass through another valve, another atrioventricular valve. This is not a tricuspid, it's called a bicuspid valve because it doesn't have 3 flaps on it. Another word for this one is the mitral valve as well. Okay, so blood that has oxygen is going to come back, go through the left atria to the left ventricle. Okay, and then now what's actually going to happen is it's going to get pumped to the rest of the body. Okay, so it's going to pass through another valve into this big artery right here, and this is called the aorta. Okay, this is your major artery here. Up here, blood would be oxygenated going to the top half of your body, and then actually down here is also the aorta, kind of curves around, and that's blood going to the bottom half of your body. Okay, and then the one other thing that we just kind of missed here, but we'll go back, is this valve right here is then going to the rest of the body through the aorta. So this is called the aortic valve. Okay, so this is the anatomy of the heart, and really in order to understand the anatomy, you really are doing yourself a service if you understand and can trace blood going through the heart. Okay, so here's the anatomy of the heart.